Hello, thank you for joining Stop My OCD. Andrew Kolsky here, and today we're going to talk about disgust-based OCD, thoughts on a new treatment protocol. This is an article written by Richard Gallagher, LMFT, so let's dive right in. All right, we need to start with some definitions. Fear. I'll get sick and die from germs is the fear. Fear is triggered by the amygdala, a brain region associated with strong emotions in response to threats. It responds to an urgent and immediate threat, such as a hungry bear, so you can fight or run away from it. Exposure will often eventually extinguish unrealistic fears or teach you to tolerate them better. And when he says exposure, he means exposure therapy for OCD. Disgust. I'll never feel clean enough and will obsess about this forever. Processed by a part of the brain called the insula, it processes sensations of disgust and stores them in our long-term memory to keep us from being poisoned by things like eating spoiled food, breathing in bad air, or spreading noxious substances on our hands. Disgust doesn't change easily, no matter how much exposure you do. And when change happens, it happens very slowly. Think months and years. ERP. One of the standard treatments for obsessive compulsive disorder is exposure and response prevention. A typical situation where a patient confronts a fear, such as touching the inside of a garbage can, for someone who has a fear of contamination, is a typical part of the treatment. Clinicians often use the same broad brush approach when it comes to disgust. However, unlike fear, the feeling of disgust often doesn't change over the course of the exposure, nor does the tolerance of it. So we're talking two different brain regions here. The amygdala, which is the fight or flight version, deals with fear, and that changes relatively rapidly in exposure therapy. The insula, which deals with long-term memory, where disgust is based, does not change as quickly. So let's look at what we're talking about here as we talk about the OCD process. In the green area, we have the OCD cycle. That cycle is obsessive doubt that lead us to worry about consequences, that cause us to feel distress, that make us want to do compulsions so that we can minimize the distress. Exposure and response prevention focuses on those last two, the distress and the compulsion. Okay. So in ERP, we know that fear diminishes over time. In exposure therapy, the amygdala learns that you are not in a fight or flight situation and your life is not at risk. Therefore, there's no need to have a fear response to a particular stimulus. Disgust, however, may only diminish over a very long time. To treat disgust, the author proposes a mastery approach versus an exposure approach. The goal is to master the situation that you avoid, even when your triggers may still remain disgusting for a very long time. Most importantly, you aren't trying to expose yourself to discomfort. You are trying to be comfortable enough to do lots of practice for a long time. Think of it as focusing on response prevention through a very, very long exposure to the stimulus in real life situations. So here's the difference between exposure and mastery. In exposure, you face your triggers head on. In mastery, you spend more time in situations that you want to master despite the trigger. In exposure, you contaminate everything, so there's no escape. In mastery, you do whatever you need to do to be comfortable and focus on reducing your accommodations over time. In exposure, you learn to tolerate distress. In mastery, you stay comfortable enough to get more reps with the situation, like doing your job or being in your house and regularly exposing to those things. In exposure, treatment is focused on exposure and response prevention to triggers. In mastery, treatment is focused around gradually improving your functioning and doing what you want to do. So what's the bottom line? Disgust-based OCD can be treated, but patients should expect to have to spend a lot more time exposed to a stimulus in real life than they would spend to conquer fear-based OCD. Okay, that gives us information about disgust-based OCD. I'm Andrew Kolsky. You can find us at stopmyocd.com. There you will find a list of all of our other videos. You will find access to an OCD support group, which is free, other OCD resources, and treatment information. Thank you for joining us, and we hope you find these videos to be educational and helpful.